Morning to our colleagues in the West. We are pleased that you're joining us for our session on Indigenous health and knowledge, a conversation on diabetes. We have two esteemed panel guest members that we're very much looking forward to hearing from, and we will let them have the floor in just a short period of time. But first, to begin with, I would like to acknowledge that I'm coming to you from Regina, Saskatchewan, which is Treaty 4 territory, the traditional lands of the Cree, Dakota, Nakota, Lakota, Saulteaux, and the home of the Métis Nation, homeland of the Métis Nation. On behalf of the Board of Directors of Diabetes Canada, I want to mention our commitment to working together with Indigenous peoples and taking important steps forward on the pathway of collaboration, reconciliation, and change. I welcome each of you on behalf of the organization to this conversation in honor of National Indigenous History Month, where we'll be exploring Indigenous health history, experience of life with diabetes, stories, and strategies for our viewers. My name is Len Daniels, and I'm currently a board member with Diabetes Canada. I'm finishing off my second term, and one of the things that's been important to me, not only as a board member, but a community member from the George Gordon First Nation, is how our organization interacts with our community and how we partner to make life better for our First Nation, Métis, and Inuit brothers and sisters, so that they have a better life. As mentioned, we're joined by two wonderful panelists who I'll invite to do an introduction of themselves right away, but a little information on each of them. Dr. Veronica McKinney is a family physician and director of Northern Medical Services and an assistant professor at the University of Saskatchewan College of Medicine. Welcome, Dr. McKinney.
Thank you. Tanse, Exein Veronica McKinney. So I am a Cree Métis woman from the northwestern part of Saskatchewan, both Treaty 6 and Treaty 10 territories, and I am currently coming to you from Treaty 6 territory. So thank you for having me.
Thank you, Dr. McKinney. Rebecca Commanda is a helper at the Cultural Services Department of Nogda-Windaman Family and Community Services and lives with type 2 diabetes. Rebecca, welcome.
Welcome. What about Joe? Get you to go discuss. Hi, my name is Rebecca Commanda. I am from Supreme First Nation, or the traditional name is Ganabajing First Nation, and it's in the Robinson-Huron Treaty in Ontario. It's a pleasure to be here, and thank you.
Thank you, Rebecca. Okay, as mentioned, we're going to hear now from each of our esteemed panel members. I'm going to first invite Dr. McKinney to share a bit about why we're here. What should our viewers know or keep in mind when discussing Indigenous health, especially related to diabetes? Dr. McKinney?
Well, hi, and again, thank you for having me here. I wanted to talk a little bit, just I guess because it is Indigenous History Month, a little bit about our history as Indigenous peoples. I'm speaking with my own bias from the Cree people, but you know, I've had the opportunity to meet with various Indigenous groups throughout our province and throughout our nation, and there are common tenets throughout all of our communities for sure. So one of the things is that pre-contact, before there were ever Europeans, there's good evidence that we had really good diets, that we were healthy people, and that we had good ways of knowing how to look after ourselves, how to care for ourselves. Our diets were primarily ketone diets, and that's true really across the country, but also even in the far north with the Inuit people as well. So what they call ketone or low carb is, you know, higher in the fat, you know, meat or proteins, and then of course vegetables and fruits. And we often had berries for fruits, or fiddleheads or spinach for vegetables. You know, I'm not that old. I'm sort of old, but not that old. But I remember even gathering spinach with my mom, and berries with my aunts and with my cousins, and things, that we had even when I was a younger person that really we're not seeing as much of these days for sure. So, and what I was just describing is how we even gathered our food, or how we did this. And we did this as a community. Oftentimes we, went together. We would get exercise and going out into either the bush or over to the lakes or wherever we were to get our food and gather our food. For the men, often it was hunting. Women would do some hunting too, sometimes with snares and things like that. I still salivate thinking about good old wampus stew, rabbit stew. So there's a lot of things that we did that involved not just the physical part of what we're eating, but how we got our food, how we connected with one another, how we connected with Mother Earth, and with, how we had that spirituality part of things, that there was rhythm and routine to everything we did. And it was a community endeavor in how we did these things. And so, everything that we did had meaning, and even the food that we eat was seen as being part of our health, part of what we would do to look after our health. And there were different foods that we would gather, or different things that we would gather in order to make our health better, depending on what people were experiencing. And so some of our traditional medicines are things that we would gather and still gather to this day from wherever we are on Mother Earth on Turtle Island. For us, it was being in the bush, and it was being along the river and being able to gather some of these medicines to treat ourselves with different things, including foodstuffs, in order to help ourselves. There was no evidence of any diabetes at that time. When contact occurred, there was more trade that was happening. And some of that was because of the decimation of our communities. Many people were dying and they were sick from the different diseases that the Europeans had brought. And so because of that, our way of life had to change. And that's where the trading came into being. And so that's where flour came from. So that's the time that bannock was introduced into our communities, because that's the one thing that's really everybody thinks about as part of our traditional diets. But in all reality, that came later, and it was related to the flour that was traded. We know that our diets were really good for a lot of different reasons. If you look at anthropological studies, there's lots of studies, like I said, that to show that we didn't have a lot of diabetes. We didn't have a lot of the diseases associated with that people lived good, long, healthy lives. One of the more recent studies are around residential schools. So when the kids were brought in to the residential schools, they had heights and weights taken. And when those kids were compared to the general population, our Indigenous children actually measured better than the general population. They were at what's called the 95th percentile, which is a sign of how healthy they were. Unfortunately, after they left residential school, they were often down to the 5th percentile or lower because of the poor things that they were exposed to, abuse, all kinds of different things. But we also know now that there were nutritional studies that were done on these kids, really bad things like finding out what would happen if they only fed them oatmeal. And I have patients to this day that don't even want to see oatmeal because it's a reminder of the residential school experience for them, or day schools, or whatever things that they were forced to go to. There were starvation studies that were done. And the other thing with the residential schools and such is that there wasn't really a lot of teachings that people could get because they were disconnected from their families and from their communities. So they didn't get to learn or be able to retain the knowledge around how to eat, what to eat, and how to do a lot of these different things. Another thing that is a good indication that we didn't have diabetes and that we had good, healthy diet is there were documentations on the Inuit people in the far north in the 1950s and 60s. And one of the things that they noticed is that they didn't have any dental cavities, any problems with their teeth. And that's really interesting because nowadays the number one surgery that young kids in our province in Saskatchewan have to come down to larger centers for is dental surgery on young kids because of all the dental cavities that they have. And so it just shows that difference in diet that we've had in years past and now what is happening today. We have much more reliance on the food we get from the stores or things like that. It's hard to even find meat nowadays that doesn't have sugar or corn syrup or cornmeal added to it. It's not so much that people are eating sugary treats all the time, not, you know, where nobody's going around eating cake all the time. But it's foods like the breads, the rice, the pastas, those types of things that all change to sugar in our bodies. And, you know, when these young kids didn't get the benefit of learning from their parents, and we've had multiple generations that have gone through this now, with, you know, residential schools being in place for over 100 years, with kids being taken out of their homes. You know, we have young children here in Saskatchewan, greater than 86% of our population in government, of kids in government care, are Indigenous kids. You don't get the benefit of the teachings from your parents and from your grandparents and from your family around how to look after yourself, how to eat, how to prepare the foods, how to gather the foods. And we've lost a lot of those pieces that really helped us to keep healthy and stay strong and to not have diabetes. And so what we see is a lot of people have very poor income, and they don't have a lot of ways to access food. Even right now, nowadays, with the cost of food, a lot of people can't afford to eat a lot of the things that we need to be eating to keep healthy. So we see poor nutrition, poor intake of nutrients. And a lot of people don't even have a way to go get food. You know, here in the inner city, in Saskatoon, there's not a grocery store. And so for people to be able to get food, sometimes they're relying on going to little corner stores or things like that. And it's a lot cheaper to buy pop than it is to buy milk. Same thing on reserve or up in the north. You know, the cost of foods is ridiculous. We can't access fresh foods like vegetables or fruit. And if you can, it's often very expensive. A 4 liter of milk in the north costs $13 or more. That's subsidized. It used to be $20 to $24 per 4 liter. And so you can imagine, as a mom with very limited income, it's a lot cheaper to buy a bottle of pop at $1.75 or $2 than it is to buy the milk. And so we know that all of those things really tax our bodies. And over time, our bodies have a limited amount of insulin that they can produce. And all of a sudden, our bodies stop being able to produce it as much as what we need. So we see a lot of things as a result of that. And, you know, not only the physical parts, I think it's, for me, my bias, like I said, is to look at things through a Cree lens, which is using the medicine wheel. But not all of our Indigenous communities use the medicine wheel. But I will use it today just because that's what my knowledge comes from. But we have the physical signs of diabetes, things like when, you know, your sugars are low, we can measure that in the blood. We can check our urines. We can do all of those things to see what that looks like physically. But we have physical symptoms too. Those feelings of feeling shaky, sweating when your sugars are either low, or feeling tired and having to lay down after a meal. Those are physical symptoms that we can experience. But a lot of what is the harder parts to deal with are those other parts of the medicine wheel. So the emotional feelings that we get with the diabetes. So tied into those low sugars is a feeling of panic and anxiety for a lot of people when they get low sugars. A feeling like you have to get that sugar right away. You have to get something right away because you just feel in your body, it makes you feel very terrible. But it's also things like, you know, having a lot of feelings of maybe guilt when you're trying so hard to keep your sugars under control, and yet they're not responding the way that you would like. You know, I often say my patients come in and they bring me their log books and they say, oh, I was bad there. I had a piece of cake. I went to my cousin's birthday. It's okay to have a piece of cake. We just need to figure out how to be able to build that in and how to do it in a way that's safe for us. And I often say that those log books are more for people to know how their sugars are being affected. But unfortunately, many doctors kind of use them like almost like a report card. And it makes us feel really guilty when we find that our sugars are too high and we're not being able to manage them properly. And not because of what we're doing, like we want to not do anything good, but because sometimes there's other things that are making it difficult. The other thing that can be hard is fear. In my family, most of my family members have diabetes for sure in their 20s. And I have got many that as a result of the diabetes have lost body parts, like pieces of limbs or their entire limb. people on dialysis, people that are really struggling. And I see how it affects them and how it affects their emotions, but also how it affects them spiritually. I look at my uncle. One of my uncles just recently lost his leg after having, and this is the thing, it's not a one-time thing. It's usually, you'll go in and you might lose a toe here or there, and then maybe another toe, maybe part of your foot. So it's like a slow process lots of times to get to that loss of your leg. But my uncle was a proud hunter. He was somebody who would, be a guide at times for others, but often would bring back food for the community and would often share with people, and was the source of food for many of our elders in particular. And for him to have lost his leg, to not be able to go out and hunt in the way that he had before, to not feel confident that he will have a sugar level that will allow him to go walk in the bush in case somebody's not there with him, that he won't die or pass out. It just really eats away at who you are as a person, and spiritually, how you feel about yourself, that sense of hopelessness, that sense of connection with other people. You feel like you're alone and isolated, like you can't do those things that you want. Even the foods that we have to be careful, and people often think about, well, what can I eat? If I go here, what am I going to be able to eat? What am I going to be able to do? So, it really impacts a lot of things. How our sugars can impact even our own participation in ceremonies. People, I know of many of my relatives, but also patients who are concerned about attending ceremonies because they're not sure how their sugars are going to react and how they will be able to manage those things. But it's also the mental part of things, all the learnings that we need to do in order to be able to look after ourselves. And it's, again, learnings over many years, I would say, because it's not only learning things like how to check your sugars and how to take the medication or how the medication works, but as time goes by, our bodies change as well. And so things are changing, and we need to learn as we're going. And it's complex things that are difficult to really get good straight answers on, I think, for a lot of people. And nowadays, with the way the medical system is, everybody's in a hurry. There's too many people, not enough people to provide the services. And I find that many of our Indigenous populations just really don't have access to the health care that they need. If you're living on reserve, it often means you have to go off reserve. You're usually in the federal system, so that means you have to get and apply for a travel to be able to leave the community, and that requires several days notice before you can actually leave the community to go to an appointment. They have to approve it. It can be a very long, drawn out process to go and be seen. And even if you have a nursing station, some of our reserves are quite large, and people don't always have a way to get there other than walking. So trying to get to even the nursing station sometimes can be hard. What medicines you have access to are limited depending on whether you're in the federal system or provincial, whether on social assistance or not. It makes it difficult to manage your diabetes when you only have certain things to do. And I also think the other problem that we're seeing is that many times the way that the students are taught is, they talk about diet and they talk about exercise, but they're kind of thinking about it from what I call a Western way of looking at things, a very privileged way of looking at things, as if you can go to the grocery store and just buy whatever they say, eat salads and, lean meats and eat 3 times a day and do all these things. If you don't have the money to do that, you just can't do that. And many times people don't want to say that to their providers. They realize that they feel almost ashamed. So they don't want to talk about what their reality is. And yet what the doctor is prescribing or what the nurse or the nutritionist is prescribing is not something that they can have access to. I often talk about exercise because people often think, well, you just have to get off your duff and get moving or go for a walk or go to a gym. But we don't have such things always on reserve, or even in the inner city. People living in the inner city don't always have access either. And I tell the story of one time I was working up in a far northern community and I wanted to go for a walk. And so the nurse handed me a crutch and I said, oh, well, what's this for? Are you thinking I'm going to fall? And she said, no, that's for the polar bears. And so it's not always safe to go out and go for a walk. On many of our reserves in the north and even down south here, there are many dogs that will attack you because they roam around in packs. And so you have to be careful when you go for a walk. In the inner city, sometimes there's gangs, sometimes there's crime, that you don't feel safe that you can go for a walk. So even though it sounds like it would be an easy enough thing, sometimes it's not something we always have access to. And I think for many of our Indigenous population, these things are prescribed, and then you're looked at as not being dedicated to making things better because you're not able to do those things. But that's not always the case either. That's oftentimes just because we don't have access to these things. So there's been many things that have led us to have these very bad cases of diabetes, and it is getting worse and worse. We're starting to see young children with type 2 diabetes. I've seen children as young as 7 or 8 years old, whereas we never used to see that ever before. We've also seen, we know that women who are pregnant can have gestational diabetes, they call that, when they get the diabetes during pregnancy. And we know that those women, more often than not, will go on to have diabetes later on. And the young kids that they've had will also be more prone to diabetes. So we have to be really careful and protect our women who are pregnant, or who may be getting pregnant, to have healthy diets and support them in good nutritional food, because that's going to have an impact on our babies going forward. And we know, as I mentioned, the cost of foods and our access to supportable income is really not very sustainable right now either. So there's more and more challenges being put in our way to be able to look after ourselves in the ways that our ancestors taught us. It's difficult for people even living in community to be able to hunt and fish and to be able to gather enough food and sustenance to be able to live on that. And many of our young people are getting away from those foods. If they grew up in the North, they don't want those foods. They want what they see on TV. They want McDonald's. They want, all those advertised foods that seem to be so good for us, but they're really not. So there's a lot of reasons why we're seeing a lot more diabetes than ever before. And, unfortunately, the diabetes that we see, it also leads to higher rates of problems afterwards as well. So things like having kidney failure, so needing dialysis, things like I said, like getting the infections and getting our limbs cut off, heart disease. Again, I got so many family I could tell you about, but I've had, an uncle who at 28 had a heart attack secondary to his diabetes from all the damage done from that. I've had another cousin who was in her 40s, and they kept thinking she had acid reflux, but it was actually her heart. And it was because she was diabetic. And so all of these diabetes are leading to all kinds of problems. And we're even now finding out that COVID, a year after you have it, some people are developing diabetes with that. So we're seeing in the past, we had really good, healthy diets. And we know that if we could stick to a diet that was more in keeping with our traditional ways, the better it would be. But we also know that we've had a lot of things that have impacted our diet all along the way, and they're not making it better. In fact, it seems to be getting worse. Having said that, we do have a lot of people now that have lived with diabetes and know how to be able to manage. So some of the things I've seen is maybe over on the West Coast, where the nutritionists started learning how to do some traditional gathering of food, and that they were taught with the elders and they worked with the elders, and then are starting to teach that along with the elders to some of the patients. And it's making a big difference. It's even learning what foods that aren't so good for us. So I often talk about pasta or macaroni or spaghetti, that if you have a half a cup of that, it changes to 15 teaspoons of sugar in your body. So instead of having that great big plate of pasta, maybe trying to have just a little bit and filling your plate with other things instead. Or how do you manage with the medications that you're taking and such? So I don't want to talk too much about that, but that just gives you a little bit of a history and where we've landed today with diabetes and why it's such a big issue in our communities. So I'll leave it at that and maybe turn it back to you, Len.
Thank you, Dr. McKinney. Excellent information and excellent commentary, which is so crucial and beneficial to our communities. I was interacting with one of my cousins a number of weeks back, and she's from the North and still has a number of family members in the North. And when I say North, our family's from Wollaston Lake. And so she was talking to me about how difficult it is to get information from the healthcare system to our communities. And so having each of you participate in this session today and having it, through Facebook, again, allows another opportunity for this information to get back to our communities. So thank you very much for your words of expertise. I think we'll move over to talking in a roundtable format and give Rebecca an opportunity to share some perspectives and insight, which will help us in terms of our knowledge and understanding on health system and what's important for us as individuals to keep in mind. And so in your experience, what distinguishes Indigenous approaches and knowledges of health? And what have been barriers to honoring this in a Western context? And how can we, and that's both Indigenous and non-Indigenous, contribute to this improvement? So Rebecca?
I want to say, Dr. McKinney, you talked about medicine wheel approach, and I really do look at my health in that way as well. And that really takes it from an Indigenous perspective of looking at your health in that way. And I look at like my physical health and how does that my diabetes impact from that, like and that also, like when you're mentally not in a good spot, your sugars go up higher. And if you're, so I kind of try and do that balance. And I talk to my knowledge keepers. I talk to even traditional healers in my community and that. And I also talk to, in my community, we have a diabetic team that actually runs like a diabetic clinic. So it's a diabetic nurse. It's like we have somebody that works in our community gym that also, and then we have like a foot specialist. And like it's amazing that we have this opportunity for my own community with having that specialist, because I hear from other communities, they don't always have that opportunity to have a team that actually sits there and listens to what you need. And they really cater to like the individual. And like you said, like your diabetes is going to change throughout your life. It's never going to stay stagnant. It's depending on how you are doing with your stress levels, what are you eating, and it's trying to find that balance. And you even like what I ate before may have changed what I'm eating now. So then I have to adjust and adapt to that. And I've been doing really well at that lately. I've got what's it called, a sensor that checks my blood sugar, so I have it on my arm right now. So that actually helps me quite a bit, and because it tells me what my levels are, even when I think, oh, it's a little bit high, but like I don't know if it's like really high. So then I have that the sensor, so I check it and I'm like, oh, okay, it is a little bit higher. So then I know, oh, okay, I could either drink some water or I can go for a walk, because we know water is life and our body is made up with 80% of water. So it's important that we take in as much water as possible. But there's also that reality that a lot of First Nation communities don't have access to safe water. So the boil water advisories that are happening in many communities. My community itself was under a boil water advisory before. And a lot of people think it's just a way up north thing. And I'm in Ontario and it happened here. And we were under a boil water advisory. And so that also changed our relationship with our food in our community and our what we ate and how we had to change and adapt that. And so I really discovering as much as I'm going in my life, and really finding the balance, and it's really important for that. And then I'm also, me and my partner are planning to have a baby soon, so I'm also trying to make sure that my sugars are in a really good levels and stuff. So I have to go see a specialist that's not in our community. I have to go outside of my community in Sudbury. So that's an hour and a half out of my community to go see a specialist that's a doctor that's specialized in pregnancy and that. So I have an appointment with her soon. So then we will talk about more strategies for me. And I really do understand even the stresses of When your sugars are really low and you feel frustrated about that, you get in those ruts at times. It's called like a diabetes burnout. That's what it's called. So it's where you think you're doing everything right, and then your sugars are just not showing it, and then you get like so frustrated because you're like, I'm doing everything that I could, but something's not going right. And so in those moments, I'll either go up to my knowledge keeper and ask them, like I'll pass them the SAMA. I'll be like, okay, I have a question for you. I either need something to help me with my mental health, or I need something to help me with my spirituality or something. I look for that. And if it's not that needs the balance, I'll go, okay, so now I got to go to my medical professionals and see if the medication needs to be higher or lower. And so it's like really trying to find that healthy balance between everything. And my family has been, whenever we do our ceremonies, we eat our traditional foods. So we'll have the wild rice, the hominy corn, or corn if we can't get hominy corn, because hominy corn is getting rare to find around Ontario right now. So if anyone has any, please send it my way. Moose meat or fish, we interchange that, and then our berries. And we know the importance of berries and how good it is for our bodies in order to have all those berries. It also just brings into my thought of in the way Mandadok, which means all my relations. If you think of our creation story, it wasn't just us and like in our immediate families. It was the minerals came first, and then it was the plants, and then it was the animals, and then we came last. And we were so vulnerable that we needed all those other families to take care of us. And so that really shows that importance, that we need all those good stuff in our life, in our diets, because that's what they were there for. They gave up their lives in order for us to live on. And what I was also taught, that we never take more than what you need. So whenever we harvest stuff, I don't always harvest just for myself, but I harvest for my grandmother, elders in the community, or just loved ones that are injured or something, and they can't go out physically. I end up thinking of them whenever I do any of the work that I do in my community. And that's why I'm known as a Gitchikakwe, with a helper, a female helper in my work. But it's also just in my whole life, I'm a helper. I'm always willing to help those in need. And I think that's where my thought is right now. I kind of jumped like all over the place. And
That's okay, Rebecca. Thank you for your insight and knowledge and sharing. I know our listeners and our audience will have found that very informative. But it resonated with me because, again, because a number of my family members and my mom and dad as well have been impacted by diabetes. One of my cousins has made some remarkable changes, not only, I guess, in his personal life, but, to his, physical well-being. And has done that through, just looking at the disease a little bit differently, and recognizing, it's possible to, have a better life, while still having a life. Everybody thinks that you can't manage because it's going to have so much disruption and impact on what you can and can't do. And that's actually not correct. That's not accurate. It's about, controlling what you're doing, in terms of physical, but also looking at what you're putting into your body and recognizing, I heard Dr. McKinney talk about, logging, recognizing what some of that food is doing to you and how your body reacts. And again, maybe making slight changes, not refraining from it totally, but making slight changes. Because I know my cousin is very active on Facebook, but talks about, how, yes, he's made changes, but it hasn't meant a complete void in staying away from certain things that give a direct reaction to how, his body responds to whatever he's putting in his body. So I guess my message is this: you can make changes. They will have some impact in terms of, I guess, how much you consume, for example. But, slight changes add up to significant changes in terms of your well-being. And so again, if there's any message that we can take away from both Dr. McKinney as well as Rebecca, is the importance of just everything in moderation. It's a lot of it is just being aware and educating yourself and learning from our esteemed panel in terms of their expertise and their sharings, and how that can help you make some changes in managing your situation. So I think I'd like to open the floor to see if we have any questions from any of our audience, in terms of those that have tuned in to hear from our esteemed panel. So, and do we have anything that Dr. McKinney or Rebecca can respond to?
We do. Thanks very much, Len. I'll just take a quick second to introduce myself. My name is Anne Besner. I'm with Diabetes Canada, Senior Manager of Patient Knowledge and Connection. And I just want to take a second to let you know that I'm joining you from Ottawa. And Ottawa is originating on the unceded Algonquin Anishinaabe territory. From coast to coast to coast, I acknowledge the ancestral and unceded territory of all the Inuit, Métis, and First Nations people who call this land home. So we have a comment from one of the viewers who just wanted to thank all of the panelists for sharing your knowledge and perspectives. Thanked Dr. McKinney for an excellent overview. And so this question goes to her. The listener is wondering if Dr. McKinney is able to share some examples of more appropriate recommendations when working with Indigenous people that are more realistic and appropriate for diabetes management.
Okay, so yeah, well, first off, I think it's important to figure out like where you're coming from, like what you do have access to or what you don't. So generally, one of the things that I try to recommend to people is protein, a little bit of protein at every meal if possible. And I talk about what does that look like? Can you have Greek yogurt instead of, regular yogurt? Do you have access to that? Trying to get plain yogurt and then sweetening with stevia instead of something else. Can you get some moose meat? Can you get some fish? Or are you having to buy at the grocery store, those types of things? And figuring out what vegetables you do have access to. I always let people know too that peas and corn are actually technically not vegetables, they're starches. So they will also raise our shares a little bit higher. So you can still have it, it's just smaller amounts kind of thing. And what do you have access to? And sometimes, there's things like, for instance, in where we are here, and even in some of our northern communities, we have something called the Good Food Box. So there you pay $20 and you get a box full of local kind of food. Sometimes it seems a little weird because you get things like squash and stuff like that, and you're kind of like, what do I do with that? So even that, just trying to help people walk through what can you do with that, and how can you make it so that, because lots of those people don't have any experience with any of those things. But the other thing, and the other overwhelming thing that I really heard from Rebecca as well, is in a way, diabetes is kind of exploring about yourself, finding out new things about yourself. And if you think about it in that way, and I also think it's a way to kind of look at, how do I connect a little bit more with the people around me, my community, or what's available? How do we reach out and do those things? And it's often hard for people to reach out. But if you can do that, there's a lot out there, both in ways of getting food, both in ways of learning, maybe going for walk, like whatever it is that you need to do. We also know that the stronger you can be in your own culture, whatever that looks like, the stronger your health will be. So we know those things as well. So it's trying to figure those pieces out. And that's what I clearly heard Rebecca talking about, is every day it's learning more and more about yourself, and things are changing, but you're still learning and trying different things. And, you know, I was really lucky. My mom was raised by her kokum, and her kokum was a traditional woman who was a traditional midwife and healer. And my mom didn't get taken away to residential school. She got a birth certificate and a death certificate on the same day because she was really premature. They didn't expect her to live. So that was lucky for us because she had a lot of knowledge that she shared with us, but we took that for granted because we didn't know. Not everybody gets to know these things. So sharing what you learn is so important. That peer support and finding out from others that have diabetes or even that don't, like, what are you doing that's working? I'm lucky because I've been able to do what I've been taught, and that's helped me. I know I'm on the verge of diabetes, but if I stick to what I was taught, which isn't always easy, then I do okay. But I've had a low sugar. I know what that feels like. It's horrible. And, you know, so I learn what works and what doesn't work for me. But that might not be the same as the next person. So, but talking about it, it's okay to talk about it. It's okay to find out what do you have in your communities and what can you do to make things work. Things like community gardens and things sometimes can be a good thing. And that's, you know, we've done that when I was young. That's what we did, is a lot of gardening and gathering of food and stuff like that. And we had a freezer. Isn't that crazy? I thought, but we had a freezer and we could freeze things. That made a huge difference for us, for sure. So just trying to figure out like what works for you. What do you have access to? What can you do? And checking in. Diabetes Canada always has great ideas, but there's also different programs, usually wherever you are through the healthcare systems, around learning about diabetes. So if you can connect, sometimes they can help out, or they can find some of the programs. And if you don't have it in where you are, they can maybe suggest ways of maybe getting that, like that good food box I was talking about. So anyways, there's lots of different things you could do, but talk about it and talk with each other about it, because you'll find out there's lots of ideas out there.
I just want to add that that's very important that you actually do talk about it. It's nerve-wracking. It really is at first, to open up, to talk about your own health and that. But at the moment that you do it, it actually lifts off so much stress off of you, and you feel like people are actually listening to you when you open up and tell them about the different health issues that you're currently experiencing. So if you're experiencing highs or constant lows, tell your medical professional or your traditional healer, whoever you see on a regular basis, and ask, like, tell them what's going on. And that way they know what steps you could possibly take. And yeah, I'm really lucky that I have a really good team where I am, that they're really open for when I tell them, like, okay, this isn't working, and we strategize together. It's not just them telling me that things need to change. I was like, no, things need to change, and you need to help me strategize a bit better.
Thanks, Rebecca. I have another question for you, actually. So coming back to you, if you don't mind fielding this question. It's with regard to what we've been hearing in the media. There are lots of troubling stories that have come out recently, and certainly not a new phenomenon, but related to people of Indigenous descent experiencing a lot of discrimination and racism in the healthcare system. So I'm wondering if you feel comfortable speaking a bit to that, whether it's from your own experience or just your thoughts about that, and perhaps where you see the need for the greatest amount of improvement with respect to that.
I do see there's some challenges for me to open up about, like, the traditional healing that I receive at times, to tell them that, like, you know, my knowledge keeper or my traditional healer told me that to use this, and then for me to bring it up to, like, a non-Indigenous person at times, they, like, the teachings behind it, they weren't there when I received all the teachings. So there's that miscommunication that they miss at times, if, like, they haven't received all the same teachings as I did right at that moment when I'm asking for that traditional healer for that help and support. And it's that little bit of fear of opening up to them, because I'm like, well, you might judge me on that, because I know I'm seeking help, but do I need to disclose that part when I know that that's still helping me? So like I really try and do a mixed method of traditional healing with the knowledge keepers and with like the non-Indigenous health. And I try and do a mixed method, but I don't always disclose all of the stuff that a traditional healer has given me, because there's so many teachings that are involved in that ceremony, and you can't always disclose some of the ceremonies that end up happening because that ceremony was only meant for you at that moment. And so like at that moment, I don't know, like there's limitations that I want to disclose at that moment when it comes to my from that.
Could I contribute too? Yeah,
Yeah,
I
please
was
go
gonna say,
ahead.
like, there's different types of racism too. I think oftentimes when you hear the word, you think of what you think of right away as somebody calling somebody else down because you're brown or whatever. And there is that. I mean, that's true. There's the internalized racism too. So that's where you see the lateral violence in communities and people, you know, put you down. Oh, she thinks she's all that. She doesn't know anything. You know, that's tough to deal with too. But it's the systemic racism that I think we really need to start addressing. So if you're living on reserve, you're getting in a different system. You don't have access to the provincial system all the time. You don't have the same access. That's a challenge. That's a big challenge. What medications you have access to, what food you have access to. That's all a system that is not allowing you the same access as what somebody else has who's not living on reserve. You know, it's how many of our people are living in poverty and on poor, low income, that we are disproportionately represented. We're disproportionately represented within the healthcare system. It's not because we're all, you know, not capable. It's because the system is not allowing us to live our best lives the same way that you would be able to if you were a non-Indigenous person living in communities. So, you know, we have to start looking at those. What are the parts of the system that are doing that? And how do we start to change that? And demanding those changes? Because at the end of the day, one of the things I go back to is some of our petroglyph teachings, which showed that, you know, the only way that we will all survive is if we all come together, all nations, all people, and put our knowledge together and use it. And it's interesting because I really feel that, like, you know, when I talk about these things, they are things that will be helpful for anybody. You don't have to be Indigenous to know that these things are helpful. And we have good ways. And in fact, some people have said that part of what COVID has shown us is that our traditional ways are very meaningful, very helpful, and that we have something to share with the rest of the world. So let's start sharing and let's start doing that a little bit more, where we can really learn from one another. But let's look at those systems, because what are those systems built on? Our healthcare system is built on a colonial system based on the old European ways. So of course they don't work for us. Makes sense. So we have to start looking, what are those ways that we can look at those systems and change them so they're open for everybody, not just one sort of group of people.
Yeah, wonderful.
Yeah,
Thank you.
I agree with both Rebecca and Dr. McKinney's commentary. The system isn't perfect, but if you don't force change, change will never happen. And, you know, one thing I've learned in dealing with my own personal health challenges is you have to utilize the system, meaning each area of the system has its area of expertise. So it's not only taking information from my doctor, but also his nurses and the people that he associates with are just as knowledgeable. So talking to them as well. And then the pharmacist. The pharmacist is very helpful as well in helping you understand some of your health challenges. And then if you are experiencing problems, there are advocates in the healthcare system that you can reach out to. Oh, and before I forget, I have gone to see a dietitian to help me understanding food and reading of labels. And I would encourage people, if they have access to that, to, you know, utilize the resource, because they are very knowledgeable and help you understand the impact of the foods that you're consuming. So excellent resources.
That's great. Thank you so much, Len. I think the next question can go to each of you, the three of you, and maybe you can each take a turn responding to this. So as health is positively correlated with a sense of security in cultural identity, accessing cultural knowledge and traditions means that culture is protective for many Indigenous peoples. Can you speak to the whole notion of culture as therapy? And maybe we can start with Rebecca.
Well, for me, using the 4 sacred medicines really does help ground me in my life. Like, so the sema, the tobacco, I hold it, I say my morning prayers. I lay it down like every morning, you know, to say, put my good intentions out. I don't ask for strength, because usually when you ask for strength, that actually has another challenge on you to show you how strong you are. So I just ask for, let's have a good day. So I start off with that, and then you know, I have the sweetgrass in my house. I give that out too, and then I have cedar, and then I also have sage, and I try and have like a really well balance in my own healing, and I smudge as much as I can. But then I also take into consideration full moon time protocols, which is whenever you're on your moon time, I don't touch any of my sacred items or my medicines at that moment. It's my, like, because you're already going through a cleanse and a healing process on that time, and it's a moment where you're allowed to reflect and do that internal work on your own. And you have, in order to know that, you need, like, I only learned that through all the different teachings that I've received from different elders, that, you know, moon time is also menstrual cycle. If for those who might ask what is a moon time, I figured that question might end up coming up. But yeah, like there's also, like, even the foods that we eat. Food is medicine. The water that we drink, that is medicine. So, like, I'm trying to consume a lot more water. I know the odd time I will pick up like a pop, but then, you know, I talked to my dietitian. I asked him, well, what kind of pop, if I do drink a pop, what kind of pop can I drink? And then they said the 0 sugar pop, that they said, oh, that's safe, that's semi-safe for you to drink if you're looking for that, like a little bit of the carbonation, like, to drink. So then I try and drink that as well, like if I'm looking for that little bit of that pop feeling, like, because I used to drink the regular Pepsi and stuff like that. So it's really just, I've just discovered like a balance of throughout my life.
Thank you. Dr. McKinney, what are your thoughts about culture as therapy?
I think it is, you know, I think there's been many traumas to Indigenous peoples throughout many years, for 100 years or more here in Canada. And so one of the teachings that I was given is that we carry a lot of those. And so if we don't work on that healing part of things, we will manifest these hurts in many ways. And so I think it is something that we work on every single day, and we learn things. But sometimes I think our culture is not only just ceremony, it's how we are with each other. And so I haven't subjected you guys to my stupid, bad humor, but I joke around a lot. And I know my colleagues comment about that a lot, that they hear laughter. And my patients say the same thing. I know where you are because I can hear you laughing in every room they're in. And that's the thing. I think humor is big. It's huge. That's part of our culture, my culture anyways. But you know, we talk and we joke around, but we make light of some of these things. And I think that's important too, in letting it go, picking out the positives and letting go of the stuff that's crappy. If it's not working for you, yeah, put it away. But laughing and not being afraid to laugh at ourselves. And I just was thinking about Rebecca saying, don't ask for strength. I know what I've been doing wrong now. No more challenges. So, you know, like just having that fun and being who you are, because we each have gifts within ourselves. So letting ourselves discover those gifts, and you know, they're all changing. And even as we grow, we still are learning different pieces. So it's good, like I said, to learn about yourself. And one of the beauties I think that we have as our culture is we don't have that ageism where you're supposed to be limited because you're older. That's kind of crap in our culture anyway. So let's just let it fly and let ourselves learn what we can do, because you will fly when you do that. So anyways, those are my thoughts.
What a wonderful lesson. Thank you. And Len.
Yeah, the only piece that I'll add on is absolutely correct is laughter. Laughter is a big component in terms of well-being. Need to keep it loose. The only other thing I'll mention is, in the Western world, we have different ways of looking after ourselves. If you have access to resources in terms of your emotional, mental, spiritual aspect of your well-being, a lot of our employers nowadays offer a component where you can reach out to your own resources. So your elders, you can reach out to Indigenous, counselors and, therapists and, psychologists, what have you. So keep in mind, again, you have resources, utilize them to whatever facet you need to help you with your overall well-being.
Thank you, Len. So we're just about at time. We'll wrap up here, but I just wanted to take a minute on behalf of Diabetes Canada to thank Dr. Veronica McKinney, Len Daniels, and Rebecca Commanda for joining us today. We're so grateful that you could sit with us today, that you could share lessons from your heart, and that you could tell us a little bit about your insights and perspectives on diabetes and healthcare. And maybe I'll just pass it back to Len for a final word to close us out.
So again, Rebecca, Dr. McKinney, on behalf of the board of directors, but also our organization, Diabetes Canada, we want to thank you for sharing your expertise, your insight, your wisdom, sharing a few laughs with us, because we all know how important this is to our community in helping them navigate the challenges that they have with this disease, but also the other challenges that they have, to overcome. So this goes a long ways to just one small thing that will go a long ways to helping them in their day-to-day lives. So thank you, like I said, on behalf of the organization. It was great to see you again. And again, I look forward to our paths crossing in the future.